Good morning or good afternoon, as the case may be, Martha. I want to thank you for being here with us today and sharing your time with us. I have done a little bit of acknowledgement of what you're doing with us and a little bit, but I want you to introduce yourself largely to our group here on the webinar. So if you don't mind, maybe just a brief minute or two about your particular credentials and as related to telehealth, as well as your professional training.
Okay, so I have a master's in counseling. I am an LPC in Colorado. I'm an LMFT in North Carolina and Virginia. I'm an LCAS in North Carolina as well. And I am a board certified mental health provider, which is a credential that took, 9 hours or such to get. I've been in private practice since 1990 and moved to Denver about 2.5 years ago, at which time I converted solely to telehealth. So this was pre-COVID. And so I've been doing telehealth for about 2.5 years now.
Okay, and what prompted you to go the telehealth or as it's also known, mHealth route?
So I had done kind of a full practice when I was in North Carolina and saw people in an office for many years. But moving here, I didn't want to ramp up to full practice. And so I thought, if I see somebody at 9 in the morning and then 1 and 4 or random times throughout the day, I didn't want to go back and forth to an office. It was also a cost saving measure, kind of convenience. And so that's what made me decide not to have an office.
Okay. And so those are some of the couple of the pros or positives for going this route. Saving you some time. I know reducing call overhead has been some of it. Are there any particular negatives or cons that you've run across that folks might benefit from hearing about?
Yeah, and I'll mention a couple of other pros.
Sure.
I have a lot fewer no-shows, and it isn't as distressing if I have a no-show. I just get up from my chair and go do something else. It is cost saving. Also, during COVID, once COVID hit, it was certainly completely safe. I wasn't exposing myself to anybody and didn't have to make those decisions that a lot of other people did. So, there are several pros, convenience, lack of commute, and all that. The cons, I don't have any coworkers that I see in person, so there's none of the kind of chit chat and kind of friendly nature of having coworkers and people you work with. So there's more isolation. I think there is some Zoom fatigue, particularly during COVID when everything was virtual. I mean, everything that many of us are involved in went virtual, and that got kind of tiring. I think being pretty new in Denver where I live now, I don't really have a great feel for local resources and local therapists in person. So it's kind of limited my awareness of community kind of resources. For me, working from home, I've got a dog who's almost always beside me, which is great, and she doesn't bark, but a lot of people have dogs, doorbells, you don't know, do you need to go downstairs to answer the door? Is it something important? Is it a package being dropped off? Just noise in the alley. We live on an alley and it's garbage trucks. And, if I have the window open, people hear noises. So, there's some cons, I guess, that way.
Yeah. And one of the things that I've talked about in the webinar aspect about around security has to do with what steps we as therapists take to minimize those distractions and make sure somebody's not outside my door listening or,
right.
My situation, my spouse, my wife is at work. So it's just me and our dogs. And so far, they haven't learned to speak a lot of Southern Appalachian. So I'm not worried about them understanding what's
And I
going
just
on.
thought of something else, like I didn't turn off my volume on my phone before we started talking.
Okay.
Happened before, my phone will ring and I'm sorry, I forgot to turn off my volume. So, that kind of thing happens and people seem to be pretty tolerant of it. Although, it's not a perfect situation, but it works well for me.
Yeah. And sometimes it almost feels like doing a pre-flight review before you fly a plane. Did I turn my phone off? Have I locked the door? Have I, that sort of stuff. And, I'm not that organized in my life at this point to pull that off every time. I do try to remember, but I don't necessarily always do it. Okay, so that's some of the pros and one of the other cons that you were mentioning to me before was the not being able to see the whole person. Could you say a little bit about that?
Well, for example, I had a woman I was working with and she was talking about her body image and she doesn't like her size and all of this. And all I see is, neck up generally. And so I thought, I have no idea if this woman is really big or if she seems to have a normal sized body. And, is this a concern that doesn't seem realistic just from my eyes? But, you can't see somebody's body. I've also stopped seeing children, families, and couples, and I'm mainly just seeing individual adults. Personally, I found it was kind of a lot to track, and I was afraid I was going to miss some subtleties and subtle cues. And I know lots of people are doing that successfully, but for me, it just seemed like another layer of things to be paying attention to.
Sure. Yeah, and I think that's part of the ethics of the whole thing is knowing where our strengths lie, what we may be good at doing, and adjusting to that. Telehealth is not for every person.
Right.
And so part of the assessment process, I think, and an ongoing assessment process, is this a good service for this person?
Right.
Am I doing what I need, what I should be doing for them? One of the things I know you and I have talked about also in the past, and you mentioned Zoom fatigue a little earlier, and you had talked to me about, when I'm in a real session, I don't look at myself. And I think at the time you told me you had been turning your camera off, so you weren't looking at yourself. Is that still the case, or have you got anything to add to that at this point?
I don't have a lot to add to that. I think it is a consideration because it's not normal for us to look at ourselves when we're doing in-person therapy. I never looked at myself doing therapy. I didn't have a mirror behind the person or anything. And it is a little distracting to see yourself on the screen. Even if I'm not watching myself, I might think, oh my gosh, that hunk of hair is totally looking weird, or, my expression looks weird. And I think that's a very natural thing, but there is the option of turning off your view of yourself. As long as you're in the frame, you can figure you look pretty normal. So yeah, I think there is that. It's just kind of odd to have yourself in front of yourself all the time, I think.
I think so. And I know the research coming out of Stanford University, that was one of the stress points that leads to Zoom fatigue was seeing yourself on camera all the time.
Right. And some therapists they don't live in a place where they can have an attractive background. I was just on a webinar today and they said that some people, there was a workplace and this guy wasn't turning on his camera, even though it was a helping organization. The supervisor was saying, I want everybody on camera for engagement. And this guy just wouldn't. And so she reached out to him. She said, what's the concern about having a camera on? He said, I am a single dad. I've got like a babysitter watching my son in the other room. It's loud. It's kind of distracting. So I'm not even going to tell you where I am right now. And I assume he was in his bathroom, but he didn't want to have himself on camera.
Sure.
Or you have a tiny house or, I don't know, a junky looking house or something. I don't know.
Yeah. Okay. what has been the general consensus from your consumers as far as pros and cons on their end of the camera?
I think one thing people like is the convenience of scheduling. You don't have to figure in time for a commute. And I've had people do this on their lunch hour. They go out to their car, they go to a park. They don't have to factor in drive time to get somewhere. It's better environmentally, you know. It's better time-wise, it's convenient. They can meet wherever they're comfortable meeting. That's also one of the challenges. And do you want me to share a couple of challenges?
Absolutely.
Probably many folks who are doing telehealth have had some stories that they could tell about some of the challenges. One of the big ones that I've experienced is that people are much more distracted than they are in the room doing therapy. I never had people on their phones or with all the distractions they've got now when I was doing therapy in the same room with them. But I have people who are at work and they'll say, oh, hang on, my boss is texting me. Or, oh gosh, that's from my mom. She's got my kids. Hang on, let me check this. Or they're eating, they're drinking. Last week I had a gal say, cheers. She's drinking a beer, you know. And
hopefully not during the DWI evaluation.
Yeah, I know. That'd be a point somewhere.
That's diagnostic.
I had somebody who always made her sessions and she was late and I called her. I don't usually chase people down, but I called her and she's like, oh my gosh, I just woke up. And I said, okay, well, we can reschedule. She said, no, that's fine. Just let me go pee. Well, she took the phone in there with her as she went to the restroom. Or I had one girl who had worked nights. She wasn't up yet. She gets on the phone. She's lying in the bed, not just sitting up in bed, which a lot of people do. She's lying down with her eyes tired. She'd been up all night. And I said, why don't we reschedule? And she said, oh, this is okay. And I thought, I don't think it is. And it just seems like you're too groggy. Or, you know, they have pets, they have children, they have doorbells, they have, you know, I've seen other family members or a roommate walk through the room, or I don't know, they get up and do stuff. I don't know. It's just distracting. I've seen people in their car outside. I've seen somebody who's in a park. She thinks she's alone. Somebody walks by. So it's much more prone to interruptions or distractions.
Yeah. And I've had a couple of situations where people have gone to their vehicles for security purposes. One was a domestic violence situation and did not want the spouse to hear what was being said, so had gone out and locked themselves into their truck. And another situation that wasn't domestic violence, but it was to get a level of privacy that was not available in the home.
Right.
And that's all I think part and parcel of the planning and the assessment of, is this a proper service,
right,
you know, kind of situation. So
right.
Yeah.
Right.
Okay. I just looking at my notes here to see if I've kind of hit on all the areas I was thinking of. Are there any areas that you can think of that would be germane to the conversation that others might benefit from? And again, just anything you want to throw out there from your experience.
Well, it helps to have a comfortable chair. And no, really, because
absolutely, you're in it a lot of hours a day.
Yeah, so comfortable chair. It's a different format, and I'm probably most of the people who are taking part in this have been doing it, I would imagine, because it seems like everybody's had to make that conversion. It's not for everybody. There's some people who just don't like it, or they don't want to get used to the technology, or they just don't like not being in the room with somebody. And I understand that. So it's not for everybody. But if you want to maintain your practice, you know, at least up until recently, you've kind of had to do that because there wasn't really an option of in-person. And so now it may be more of an option as we start maybe hopefully coming out the other side of COVID. So maybe there'll be some people who don't want to do this remote anymore. Some will probably do hybrid.
Yeah, I was going to say hybrid, right?
But I know of several people personally who've given up their offices. They paid rent for 6 months or a year. Yeah. And they just end up at home, and they like it, and it's convenient for everybody. But it's not for everybody. Some people really just don't like doing it. So it's probably just personal preference. And, I think, when I talk about people being so much more distracted, I did miss the in-person aspect of the therapy when, the door was closed. Nobody was going to knock on the door. Nobody was looking at their phones. There were no distractions. Nobody was going to call them. It seemed like pure or something, like we were in there kind of locked in for 50 minutes. It was a different level of intensity.
Yes. Yeah. Well, and I think back to, and I don't want to age either one of us, although everybody knows I'm probably, by now they know I'm old as dirt. But when we worked together in an agency setting back in the days of the community mental health system in North Carolina, would you ever have imagined that we'd be doing telehealth?
No. But I think that was in the pre-computer days, right?
Yeah. Pretty much. You may have been there just on the end of the non-computer days, and we moved into having one computer. So, but yeah, the evolution of therapy has been quite a bit. Before we go here, I wanted to give a little webinar, Adventures in Telehealth bonus. And I was going to ask you if you would like, for those of you who don't know Martha, she is the author and co-author of at least 2 books that I know of. And I was wondering if you might like to make mention of your 2 books.
Sure, thank you. One is called Overcoming Compassion Fatigue, a Practical Resilience Workbook. So it's for compassion fatigue, burnout, and all that among helping professionals. And probably all of us could use some of that support these days. The other one is on treating chronic pain, and I think it's called Treating Chronic Pain, Pill-Free Approaches to Move People from Hurt to Hope. And that's co-written with my husband, who's a family physician. So there's a lot in there about the medical aspects of chronic pain, and also kind of behavioral tools and how to help people with chronic pain.
Good. All right. And I've read that one in cover to cover and used it. I highly recommend people get it. It is available on Amazon. I know that. So it can be ordered from there. And I'll put a link in down on the resources page in the overall webinar. Well, Martha, thank you very, very much for taking time out with us today. I'm sure it's a beautiful day out there in Colorado, and you might want to take the dog and go for a walk now.
Yeah.
But thank you so much for sharing your time and your expertise with us today.
Thank you.